In my address to the Council in 2019, I spoke about what a luxury it is to meet face-to-face when we can do so much electronically. Little did we know how much of an unattainable luxury a face-to-face meeting would be just a year later. These truly are unprecedented times, and let me start by wishing that you and those you love are safe and healthy. We have lost from our radiology community, and we mourn that loss. Many of you have suffered from this disease, and many more are scarred by the challenge of caring for our communities. I salute each of you, especially so many of our trainees who have put your own safety on the line for the care of your fellow humans. I want to start by thanking the Speaker and the Vice Speaker for the opportunity to address the Council today, and to register my great admiration for the way in which they, aided by our incredible ACR staff, have created a virtual meeting and governance process that ensures the continuity of our organisation and provides a way for us to connect virtually. Many other societies have cancelled their meetings. I'm proud that using our ingenuity and collective imagination, we have created a way for our members to come together and shape our professional future. I'd also like to recognise our honorees and our fellows, and to applaud the care and thought with which our President Monticello and her staff colleagues created a virtual convocation ceremony, and I hope we can welcome many of you to celebrate in person next year. In a recent thought-provoking interview, Rabbi Lord Jonathan Sacks reflected that there are events that you live through and events that change you. This pandemic ticks both of those boxes. And as we have lived through this crisis, I have learned so much about our resilience and humanity as a community, and about the foundations on which our organization stands. Over the years as an organization, we have strategically invested volunteer time and expertise and financial resources in meeting our stated goal that ACR members are universally acknowledged as leaders in the delivery and advancement of quality healthcare. The stress test that this pandemic has applied has revealed the results of our collective investment. We have demonstrated our leadership in providing guidance on the appropriate use of imaging in COVID-19, guidance which has resonated across the globe. We spoke with clear leadership on behalf of our patients and the safety of our teams regarding the cessation of non-urgent imaging and treatment, even though this caused us personal financial hardship. We leveraged our wealth of educational resources to support our own redeployment across subspecialties, but also to provide continuity to our trainees. Our wellness community has rallied with tools and materials to allow us to care for ourselves, even as we care for others. And we have leveraged our leadership role in advocacy by influencing a divided Congress to provide relief packages that recognize the critical role that radiologists play in the delivery of care, and especially the practices in rural areas play in supporting their communities, both as care providers and employers. And we have harnessed our research and data science experts to develop a comprehensive registry that links both imaging and clinical data to allow us to learn from this plague and improve human health for the future. It may be too early to apply the past tense to this pandemic, but I'd like to reflect a little on how we will be changed by it. While we hope that the shared humanity and collegiality will survive, we may find some of the other adaptations more threatening. How might permanent relaxation of state licensure barriers and expansion of scope of practice for advanced practice providers impact how we practice? How will the looming recession or even depression impact us? Undoubtedly, practices will struggle to recover after a prolonged period of significantly reduced volume. Will a challenging job market for our trainees impact our ability to recruit the brightest and the best to radiology? The work that you, the Council, will do to set policy over the coming days will inform the work of the Board over the coming year to develop and execute a strategy that will position the College to optimally influence and shape an uncertain future. But while we confront our brutal reality, let me paint a more optimistic vision for the future. If our financial reality looks uncertain, we can rely on our expert advocacy and economic teams working on the development of innovative reimbursement models that drive appropriate imaging. Our human resources and patient and family-centered care teams will lead us in creating practice models that preserve our autonomy and allow us to exercise our humanity as family members, physicians, and colleagues. Scope of practice threats outside of the trusted radiologist-technologist and radiologist assistant communities will be mitigated by a rigorous and transparent assessment of individual and practice performance and an assessment of the contribution that radiologists make to patient outcomes, work that is led by our quality and safety team. The creation of more seamless information exchange during this crisis may finally mean that relics like the CD for image transfer will be the only welcome casualty of this pandemic, thanks to the Ditch the Disc efforts led by our Informatics Commission. We will build on our educational offerings and create more that are tailored to our residents, to lifelong learning, and that work will be ably led by our Commission on Publications and Lifelong Learning. And our Research Commission, in collaboration with our Data Science Institute, will create the science that informs our future practice. And lastly, rather than consign in-person meetings to history, I think we will treasure them more than ever. Such a future is far from guaranteed. We will have to come together around our shared values more tightly than ever. Our essential diversity of practice type and location and subspecialty must coexist with a unity of purpose as medical imagers under the umbrella of a strong ACR. This is not the time to focus on academic versus private practice, single versus multi-specialist, DR versus IR. We are one imaging community and we are stronger together. We must, however, increase our diversity along the axes of gender and ethnicity in order to better reflect the values and needs of the communities we serve. As I reflect on the past 2 years as your chair, I want to stress that the work of the college far transcends any individual's efforts. But I've been unapologetic about focusing on some key initiatives that tightly align with the strategic plan. Using the power to convene and the power to set the agenda, I'm proud that we have taken on complex and controversial issues like professional certification and gun violence, and that we've made a clear statement that dissenting voices are welcomed, not suppressed. Having led the economics team that convinced the government to pay for lung cancer screening, I am committed to making sure that all who are eligible have access to this life-saving procedure. A community-wide effort means that we've doubled the volume of patients screened, and while that still leaves a huge number of lives lost unnecessarily, I'm optimistic that we're on the right trajectory. Other things I'm delighted to see evolve in these 2 years are the more robust engagement of our membership in council activities, including another incredibly strong slate of candidates for the elected offices, and I wish you all good luck. In 2 years as your board chair, I have had the opportunity to conduct an orchestra of committed volunteer leaders on the board and work with so many others across the organization. I've had the privilege of spending time with many of you in your home states, and to use my position to recruit many of you into leadership and to foster the horizontal connections that strengthen our foundation. I've been able to execute on my commitment to diversity and, yes, new power, and I've been proud to act as your advocate and ambassador across the healthcare delivery ecosystem. I've been incredibly well supported by my home department at Weill Cornell Medicine under Dr. Rob Minn's leadership, and his belief in the value of service to organized medicine is a model to which I hope many other departments and especially private practices will subscribe. I've been humbled to know that supporting our volunteer effort is a cadre of unbelievable ACR staff who are just as passionate about our ACR mission as we are. I'd like to thank each and every one of you. I could not have executed on this role without your support. I transition to a more than capable successor. My friend and colleague, Dr. Howard Fleischon, has devoted his professional life to advocacy, both to patients and our profession. I thank him for his partnership over the past 2 years and know that our organization will become even stronger under his able leadership. Rabbi Sachs said one more thing that has resonated with me. He said that each of us must ask the question, what does this moment ask of me? I could not have lived through this pandemic in New York City without being confronted with the need for our healthcare system to change fundamentally if we are to fulfill our oath to our patients, especially those who have been subject to gaps in care and disparities in outcome. I will therefore double down on my focus on inclusive leadership and do whatever I can to ensure that we create a better healthcare future for those we serve. Thank you for the privilege of serving you and our organization. I look forward to the next time we meet in real life, and until then, stay safe.